Hey, Dr. Tyler Williams with Better Sleep SLC. Thanks for joining us for today's video. And we're here because you have some questions about alternatives to CPAP. So one of the most common fears that our patients have or new guests bring up when they meet with me is, hey, if I have some type of sleep or snoring condition, do I have to wear a CPAP? And so I want to share with you some alternatives to CPAP and things you can look for, things that may help you in your journey. Now, if you have some specific questions on your exact circumstances, it may be best to set up a consultation. You can call or text the number below this video. Happy to answer your questions on the phone and set up a consultation with one of our team members. And then we can go through some options with you and provide a booklet that will give you additional information. But back to the question of alternatives to CPAP. Generally, there are two main alternatives to CPAP as far as treatment goes. So if we rewind a little bit to sleep apnea and what it is, it's when your airway gets blocked when you're asleep, generally by your tongue, and it causes you to stop breathing. And so your three options typically are CPAP, which is CPAP, that stands for continuous positive airway pressure. What a CPAP does is it seals around your mouth, and that mask blows air constantly to overcome the resistance from your tongue and your blocked airway to push air into your lungs so you can breathe and get oxygen. The second option is OAT, that's Open Airway Therapy. That's where we use a device that goes in your mouth that keeps your jaw and your tongue in a position to allow you to breathe and exhale on your own so you can get oxygen when you're asleep. And then the third option is surgery. That's where surgically your jaw or throat or airway is being changed, or more commonly now is the tongue nerve stimulator, which is known as the Inspire implant. And that basically is a pacemaker that tells your tongue to come out of your mouth every time you stop breathing, which you may get hundreds of movements per night of your tongue. So those are kind of the three main options. Now, there are some other things that we can go through that support this, such as the position you sleep in and diet and exercise. Those only improve the therapy. However, we've not found, and studies do not support, that if you have sleep apnea and you simply change your diet or sleep in a different position, that's going to take care of what could be a life-changing or even a life-threatening issue in some cases. So with CPAP and the oral appliances, those two have been around longer. The Inspire implant is newer, and it's the most costly by far. However, people who it works well for the most part, seem to enjoy it and appreciate it because they don't have to have any procedures, or they don't have to have any hardware worn on their face. But most insurance companies now are starting to require that you try a CPAP or an oral appliance first for your snoring or sleep apnea before you would qualify for the Inspire, because the Inspire usually costs 8 to 10 times more. And that's part of insurance, is going with the least cost but effective option. So CPAP's been around the longest. It works well. You're watching this because you're looking for an alternative. And so you may not have to wear a CPAP. The next option that's been around the longest is oral appliances. We have probably well over 20 years of research and studies documenting the effectiveness of oral appliances. They've been around actually longer than that, but they're FDA approved for treating sleep apnea. And depending on the type you have, you may be able to use that as a standalone treatment, or sometimes in addition to another form of treatment. So some of our patients are doing CPAP plus oral appliance. Some are doing Inspire plus oral appliance. Most are doing oral appliance as a standalone treatment. But there's no right or wrong treatment. Everybody's different. Everybody's needs are different. Everybody's airway is a different shape. Everybody's sleep apnea is different. The most important thing is that you're getting treatment and you're working with a sleep team. So if you're interested in an oral appliance, for example, you want to typically avoid a dentist that can make a mouthpiece, or that makes one of these once every 6 months or once a year, because they're not going to be able to provide the follow-up support. So for me, doing this over 13 years now, is it bridges the gap between medicine and dentistry because the device is a dental fitting device. However, we're treating a medical condition. So work with a team that can utilize both philosophies of healthcare as well as has the experience and the ability to know that, hey, if the appliance isn't quite getting the results, what are some options or things we can adjust? Also knowing the difference between an appliance that's approved by Medicare and one that is approved by traditional medical insurance, and having some options in that realm. So most people who are looking for an alternative to CPAP go with an oral appliance because they're effective. They're generally the easiest to wear and the easiest to transition into of any of the three options because they're not invasive. The other advantage is most people with sleep apnea that we see have a history of teeth grinding or clenching, dry mouth, tooth damage, lots of root canals, crowns, implants, those kind of things. And so the appliance not only helps you sleep better and breathe better, but it also helps you to be able to protect your teeth better so that if you clench or grind, it's going to be supported and prevent things like TMJ and headaches and migraines. If you're suffering with morning headaches or dry mouth, we tend to also see an improvement for most people with an oral appliance. Same with snoring. When you get a sleep appliance, you want to be looking for someone who can adjust your mouth to specific positions and be able to have you snore and figure out where the best range is. Usually we can put your mouth in some different positions and find where the least amount of snoring or the least amount of sound is while you're in the office so we can reproduce what may happen when you sleep. We find that helps out quite a bit. So if you have some further questions, don't hesitate to reach out or check out some of our other videos that answer more questions on the topic of snoring versus sleep apnea.